I'm going to be talking about another common condition, the season for dengue fever. Now, oftentimes a child begins to get a fever, and that's about all he has. And soon, if the fever gets very high, and the child also starts complaining of quite a severe headache with pain around the eyes, on the back or the back of the neck, and becomes somewhat irritable, then one needs to consider that this might be a case of dengue fever. The fever in this particular instance not only is high but is constant and stays for a number of days. It may take 2 to 4 or 5, sometimes even 7 days, and the fever does not seem to respond to the usual medicines that are being given. The child may become irritable, and he might actually get some aches and pains in his legs or joints, and sometimes there is a bit of a rash that appears on the body. If this happens, then it is important that you check with your doctor, because the doctor will examine the child and make sure that this is not a case of dengue fever. Now, what is dengue fever? It's a seasonal fever which is caused by a virus which is carried by a particular kind of a mosquito. This mosquito is different from the mosquito that carries malaria. This mosquito lives in relatively clean water, and water that may be around the house. So, for example, water in coolers in the house, around the house, in the yard, in the garden. It might even be inside where you have kept some plants and you keep watering them, or you have a standing water of any kind at home. It might be a glass of water or a pitcher of water. So you have to be very careful. You should either not keep this water at home, or if water is standing, then you should make sure that it is covered or removed if it is especially in the garden or in the yard. These mosquitoes will often bite the child, or grown-ups for that matter, generally early morning, the early morning prayer time, or in the evening hours as the sun goes down. So those are the favorite times for the mosquito to bite, and obviously many times you can't tell when the mosquito has bitten. So the fever is very high and there is discomfort, and sometimes there is a rash, and the rash can get pretty bad. So what is the doctor going to do? He's going to run a test on the child, and that test is a blood test in which he will do a complete blood count and look for platelets, which are small particles present in the blood that are involved in clotting of the blood. So whenever you get a cut, it is these cells that will control the bleeding. In this case, the platelets become very low, and there are, of course, other tests that will detect dengue. The treatment is by and large to make the child comfortable. So medicine for fever, plenty of liquids, rest, and making sure that you stay in touch with the doctor. There is no specific treatment, and antibiotics again are not going to help. So this disease can become very serious, and if the platelets become very low, or if the child starts to bleed, or is becoming absolutely lethargic and not very aware of what is going on, then this is the serious form of the disease, and you must get in touch with the doctor right away. So it is a serious disease, this dengue, but if you're careful and you can prevent it, and prevent it by making sure that there is no way a mosquito breeds in the house or around the house, then you can protect your child. So again, once again, protection is and prevention is better than cure, and you need to be even more careful during this season.